Vaccination is the biological preparation administration of some particular antigenic material to stimulate an individual's immune system to develop adaptive immunity to antigen or pathogen, to prevent particular disease. A vaccine can help for active immunity against a specific harmful agent by stimulating the immune system. Vaccination schedule is very important. Childhood vaccines protect children from a variety of serious or potentially fatal diseases. Vaccination is the most effective method of preventing infectious diseases. Vaccination helped to the worldwide eradication of smallpox and the elimination of diseases such as measles, polio, and tetanus in a greater extension from the world. Are vaccine side effects dangerous? Any vaccine can cause side effects. Usually, these side effects are minor, low-grade fever, fussiness and soreness at the injection site. Some vaccines cause a temporary headache, fatigue or loss of appetite. Rarely, a child might experience a severe allergic reaction or a neurological side effect, such as a seizure. Immunization or vaccination schedule for child. Know about different vaccination schedule, meet your doctor and get the proper dose with your doctor advice for proper guidance. Protect your child with proper vaccination schedule. Hepatitis B Hep, ideally the first dose is given within 24 hours of birth, the second at 1 to 2 months, the third at 4 months, if needed, and the last at 6 to 18 months. Child needs 3 to 4 doses of hepatitis B vaccine. Diphtheria, tetanus, and whooping cough pertussis, DTaP and TTaP, two kinds of vaccines used today. 1. Diphtheria, tetanus, and pertussis, DTaP, vaccines and 2. Tetanus, diphtheria, and pertussis, TTaP, vaccines. Haemophilus influenza type B, HIB, child needs 3 to 4 doses of HIB vaccine, depending on the brand of vaccine. The first dose is given at 2 months, the second at 4 months, the third at 6 months, if needed, and the last at 12 to 15 months. Hepatitis A HEPA, child needs 2 doses of hepatitis A vaccine. The first dose is given at age 1 year and the second 6 to 12 months later. Polio IPV, child needs 4 doses of polio vaccine, IPV. The first dose is given at 2 months, the second at 4 months, the third at 6 to 18 months, and the fourth at 4 to 6 years. Influenza flu, the flu vaccine is recommended for children 6 months and older. Some children younger than age 9 years need 2 doses. Ask your doctor if your child needs more than 1 dose. Measles, mumps, rubella, MMR, child needs 2 doses of MMR vaccine. The first dose is given at 12 to 15 months and the second at 4 to 6 years. Pneumococcal, PCV, child needs 4 doses of pneumococcal, PCV. The first dose is given at 2 months, the second at 4 months, the third at 6 months, and the fourth at 12 to 15 months. Some children also need a dose of pneumovax vaccine, PPSV. Ask doctor. Rotavirus, RV, there are 2 rotavirus vaccines that can protect children from this disease. The first dose is given at 2 months, the second at 4 months, and depending upon the brand sometime the third is needed at 6 months. Chickenpox, varicella, a child needs 2 doses of chickenpox vaccine. The first dose is given at 12 to 15 months and the second at 4 to 6 years. This is the common vaccines usually which all are prescribed, but there are so many vaccinations is available.
Our website www.medihelp365.com. Find doctors, hospital, medical service providers. read medical articles and lots more. Subscribe our YouTube channel, Medical Help 365 Days, to medical videos.